Welcome to your first lesson 1.1, the Healthcare Essentials. In this lesson, we will walk through the services, products, and finances of healthcare. This lesson is your first categorizing lesson that teaches you how to sort healthcare. You will see that throughout this program, healthcare, because of its enormity and size, you will constantly categorize, classify, and group healthcare into compartments. This video may go a little fast, so if you haven't done so already, have the presentation notes in front of you. And be sure to watch the video all the way through for the first time, and then go back to the parts that you need more clarity on. In this lesson, we will begin to develop capabilities to govern care more efficiently and effectively. So that way, we will be able to conceptualize more sophisticated concepts later. So your lesson takeaways are, you will be able to define healthcare, you will be able to classify healthcare into 3 essential branches, and be able to discern how those 3 essential branches in healthcare applies to your office visit.
First, let's define what is healthcare. Healthcare is the improvement or maintenance of health via the prevention, treatment, diagnosis, illness, or injury, and any other physical or mental impairments.
The 3 essential branches in healthcare are services, products, and finance. Healthcare services is the furnishing of medicine from a doctor, nurse, or any other healthcare professional with a license recognized by the state to practice medicine. Healthcare equipment or products include any physical tool that the healthcare providers use in conjunction to services. Healthcare equipment or products include surgical equipment, durable medical equipment, medication, medical accessories, gloves, stethoscope, or table. Healthcare finances pertains to the form of funding where people, medical offices, and third-party payers or insurance companies pay for medical expenses. There are 2 primary forms of healthcare finances. The first example would be when a patient opts to pay cash for medical services and eliminates the need for third-party payers. This form of financing is called self-funding. However, it is far more common where patients have a third-party payer to help them with healthcare costs. This financial relationship with a doctor, patient, and third-party payer is intertwined. Now that we know the 3 branches in healthcare, let's take a trip to the doctor's office.
Meet Lucy. Today, she has a medical appointment to get her annual physical examination. She will encounter a number of support staff members, but as for today, we will focus on the people who provide Lucy with the clinical services, including the medical assistant, the doctor, and the phlebotomist.
To ensure that Lucy has the most pleasant experience, clinicians will reach for products such as
vials to hold her blood, a needle to stick her arm, gauze and a Band-Aid, and a communication system that will help Lucy move throughout the clinic.
Since Lucy works with a third-party payer to help with healthcare costs, some of the finances for her examination will be, according to her insurance plan, are the deductibles, copays, and some other out-of-pocket expenses. And she has also anticipated her portion of what she will need to pay after the claim is processed. Sure, walking into the medical clinic might be a little intimidating at first, but now that we have categorized our 3 essential branches from healthcare services, products, and finances, we are able to walk into the clinic and understand a little more what's going on. And that concludes our video for today. Be sure to join me in Lesson 1.2 to take a closer look at healthcare practices and staff.